Congestive heart failure, CHF. 1. Introduction. CHF is a progressive clinical syndrome resulting from structural or functional cardiac disorders that impair the heart's ability to pump blood effectively. It leads to inadequate tissue perfusion and fluid overload affecting multiple organ systems. 2. Definition. Congestive heart failure is defined as the heart's inability to maintain sufficient cardiac output to meet the metabolic demands of the body, either due to impaired contraction, systolic failure, or impaired relaxation, diastolic failure. 3. Pathophysiology. Systolic HF, HFrEF, myocardial contractility, ejection fraction, 40%, diastolic HF, HFpF, stiff ventricles, impaired filling, preserved EF. Compensatory mechanisms. RAS activation, vasoconstriction, sodium water retention, sympathetic stimulation, heart rate, contractility, ventricular remodeling, hypertrophy, dilation, worsening function. 4. Diagnostic criteria. Symptoms: dyspnea, fatigue, orthopnea, paroxysmal nocturnal dyspnea. Signs: peripheral edema, jugular venous distension, pulmonary rales. Tests: BNP/NT, proBNP, elevated in CHF, echocardiogram, EF measurement, structural abnormalities, chest X-ray, cardiomegaly, pulmonary congestion, ECG, arrhythmias, ischemia. 5. Clinical manifestations. Left-sided failure, right-sided failure, dyspnea, cough, crackles, peripheral edema, hepatomegaly, ascites, fatigue, exercise intolerance, jugular venous distension, weight gain. 6. Non-pharmacological management. Dietary: sodium restriction, 2g/day, fluid restriction, lifestyle: regular aerobic exercise, smoking, alcohol cessation, monitoring, daily weight tracking, symptom diary education, medication adherence, early symptom recognition, device therapy, ICD or CRT in select patients. 7. Pharmacological treatment. Drug class examples: role, mechanism, ACE inhibitors, enalapril, ramipril, afterload, RAS inhibition, ARBs, losartan, valsartan, alternative to ACIs, beta blockers, metoprolol, carvedilol, sympathetic tone, survival diuretics, furosemide, torsemide, symptom relief via fluid removal, aldosterone antagonists, spironolactone, eplerenone, remodeling/mortality. SGLT2 inhibitors, dapagliflozin, empagliflozin, hospitalization plus cardiac efficiency, digoxin, contractility and hospitalization, vasodilators, hydralazine plus ISDN for African American patients with HFrEF. 8. Therapeutic goals: alleviate symptoms and improve quality of life, prevent hospitalizations and disease progression, reduce mortality and improve survival, optimize cardiac output and neurohormonal balance, promote adherence and patient self-management,